I'm Lori Conti, presenting for Brain Injury Awareness Month. While my husband has said 7 major head injuries, he has no lasting effects. Some of you have had major head injuries and have had no lasting effects. But remember that multiple head injuries can increase your chance of having lasting effects. For example, in 1982, I was in a car accident where I was knocked out and I had no lasting effects. 1991, I was in another car accident. I was hit by a drunk driver head on, hit my head on the windshield, and had lasting effects. I had post-traumatic seizure disorder for 5 years. I was able to be treated with medication though, and I kept my job, and I had 2 children, ages almost 1 and 4, and I was able to raise them. I had a soliloquy of symptoms that led my doctors to discover a meningioma brain tumor. And I was able to have that successfully removed. And as I recovered from the surgery, which also can be classified as a brain injury, that would be an acquired brain injury, my symptoms disappeared. And I was able to go back to work, and I was recovering very well. Unfortunately, 8 months after my surgery, I had another traumatic brain injury, or TBI, when my foot got stuck in a cart and I got dragged on my head. Now, I feel blessed that I had had my brain tumor prior to this injury because I was wearing a helmet, which cracked open. That could have been my skull. As it was, I did endure hemorrhaging in my brain and swelling, which we believe was the major cause of my lasting effects. As far as my symptoms go, I do have cognitive issues primarily, but I also have sleep disorders, a loss of stamina. My speech, if I am brain fatigued, understanding you and communicating with you becomes difficulty. I have heightened sensations, therefore integrating and understanding the information that I've gained through my senses is taxing and very difficult. I have fluctuating emotions. I'm irritable, aggressive. I have anxiety, I'm depressed, and I also have a lack of inhibition. I think I can do anything. Sometimes I can. And I also have a lack of awareness of my shortcomings. I know that a lot of these symptoms will seem familiar to you because whenever a person is stressed, these are symptoms that appear, especially the cognitive category. Also, sleep deprivation conjures up these symptoms. A lot of the emotional social symptoms are familiar to you too: depression, anxiety, emotional lability. Depression, anxiety, emotional lability. So I know you understand the symptoms that I'm experiencing. Don't feel that you have a traumatic brain injury just because you experience them. Take care of your sleep hygiene and reduce your levels of stress, and you'll probably have an alleviated symptom list. With a TBI, your symptoms don't go away. You do learn how to cope, and I am forever grateful to my supportive team, which includes my family, my children, my parents, my sisters, brothers. My husband is my primary caregiver, and my medical team, including a speech and language therapist, and the team at Dent Neurological, and I have a counselor that has been life-saving. I have so many compensatory strategies, and I'm going to be sharing those with you throughout the month of March. hoping that you will be able to take some of these compensatory strategies and incorporate them into your life as well. You don't need a brain injury to use these strategies. Thank you for listening. I hope you'll tune in whenever I get my next video uploaded. This is Brain Injury Awareness Month, 2016.